Hi everyone, we're from group 23 and in this video we're going to talk about calcium ion signaling. So how does this process occurs? What is the importance and role of calcium signaling in our heart? And which channels does our CCB drug inhibit? And the dysregulations of calcium ion signaling can lead to what disease? So first of all, we're going to talk about calcium signaling. So how does this occurs? So the action potentials will enter from the adjacent cells, and this will lead to the opening of the voltage-gated calcium channels, and this calcium ion will enter the cell. This will further lead a calcium-induced calcium release from the sarcoplasmic reticulum through these ryanodine receptor channels. The release of calcium ion will cause calcium sparks, and the sums of all these calcium sparks will create calcium signal. So our calcium ion will bind to the troponin and then it will initiate contractions. So when our calcium ion unbind from the troponin, this is when our relaxations will occur, and this calcium ion will either being pumped back into the sarcoplasmic reticulum for storage or being exchanged with sodium ion. And this sodium ion gradient is maintained by the sodium potassium ATPase. Alright, so we'll move on to the importance and role of calcium signaling in our heart. So the role of calcium, it is used for the contractions of our heart. It couples the electrical excitations of the heart to contractions. So the importance of this calcium signaling is because it modulates the electrical activity of the heart. It also modulates energy metabolism and regulates gene expressions. So the dysfunctions of calcium dynamics is thought to play a role in cardiac arrhythmias. So our calcium channel blockers, they inhibit obviously our calcium channels, and there's a few types of calcium channels found in the heart. So there's a low voltage and high voltage. So the low voltage calcium channels will be our activated T type, and the high voltage will be our activated L and PQ and R type calcium ion channels. So basically these L type channels, they are predominantly expressed in the heart and peripheral vasculature, in which it usually serves as a target in the treatment of hypertension. So the selectivity of our CCB is achieved because due to binding to different sites on the alpha-1 subunits. So under CCB, there's a few subgroups. First one will be our phenylacylamine, which is our verapamil. We have benzodiazepines such as diltiazem, and of course dihydropyridines. There are 3 generations of it. Alright, so our verapamil, basically it blocks both activated and inactivated L-type calcium channels, and since it can cause peripheral vasodilations, it may be beneficial in hypertension. Do note that verapamil can induce a AV block when used in large doses or in patients with AV nodal disease. Alright, so since our cardiac muscles is highly dependent on calcium influx during each action potentials for its normal functions, the action potential may be reduced or blocked by our CCB. So this will cause a decrease in contractility and conductivity of our heart, thus decreasing the oxygen demand, which is beneficial especially in patients with angina. So the side effect of our CCB will decrease in BP. That's why it is also used to treat hypertension. It can cause bradycardia, AV block, headache, abdominal discomfort, such as constipation and nausea, and also peripheral edema. So last but not least, these regulations of sodium ion signaling can lead to a few diseases such as Alzheimer's, asthma, and all these things. So in Alzheimer's, they basically enhance in IP3 calcium ion signaling in neurons, which activates memory loss. In asthma, there's the IP3 calcium ion signaling pathway will cause pulmonary smooth muscle contractions. In atrial arrhythmia, the enhance in IP3 calcium ion signaling will lead to development of atrial arrhythmias. And in hypertension, the enhance in IP3 calcium ion signaling will contribute to the increase in smooth muscle tone. All right, so all from us. Thank you.